The Cancer Institute at Greenwich Hospital is a comprehensive cancer program. We have leading technology, we have some of the finest physicians, and we have support programs and an environment that helps patients cope with their illness.
The Greenwich Cancer Institute offers the latest treatment options in many of the tumors that we treat, and some of them are really cutting edge and state-of-the-art.
We are committed to providing the latest technology and recruiting highly trained, board-certified physicians and other support staff who have outstanding credentials.
Our surgery is absolutely first-rate. We have a full range of chemotherapy services here. Finally, we have a greatly enhanced radiation facility.
Multidisciplinary care is key for cancer patients. They're not just seeing one doctor. Usually they're diagnosed by a surgeon, but they'll see a medical oncologist, a radiation oncologist, radiologist, pathologist.
Cancer can be a terrifying diagnosis. We want to be a state-of-the-art program that delivers comprehensive and compassionate care to the residents in our region.
I was shocked. It hit me like a ton of bricks. Everything was normal with my life, and these symptoms came up. I was diagnosed with early stage 1 of esophageal cancer. If not treated early, is completely fatal. I left the office, sat in my car for a while, called my wife, and for a few minutes we just didn't know what to do, and then we started our research with relatively very quickly.
Harold was a lucky man. He had a tumor that presented itself early, and I was able to remove that with an operation that basically took out his whole esophagus and replaced it with a reconstruction using his stomach. We were able to do that here at Greenwich Hospital. We now, and I would say the majority of times, perform the surgery through small 1-inch incisions using television cameras and special instruments in a minimally invasive fashion, which of course adds a far better outcome. The patient's in hospital for less time, they have less pain.
It was an absolute success. I was in the hospital for 10 days. Today, I feel fabulous.
Our affiliation with Yale New Haven Hospital and the Yale School of Medicine has allowed us to expand into new areas. For example, we have a state-of-the-art radiation therapy program. We've partnered with them to be medical directors of our program.
Only your math stuff needs to be on your desk. Anything else, off.
When I was first diagnosed with cancer, I was shocked. Was not expecting it. I think I tried to keep a good front and a strong face. I just jumped into a mode of, okay, this is what I've got to do, and let's go.
Mr. Langworth was diagnosed with a testicular seminoma. It's a type of cancer that tends to occur in men in their 20s, 30s, and even into their 40s. We met in a multidisciplinary tumor conference. A multidisciplinary plan was made where the surgeon removed the tumor, and this is a type of cancer that can recur in the lymph nodes if there's no further treatment. We discussed various treatment options and discussed these also with the patient, and he opted for radiation therapy here at Greenwich Hospital. We were able to treat the at-risk lymph nodes with appropriate low doses of radiation. He sailed through treatment. I'm happy to say he had basically nothing significant in the way of side effects, and in follow-up he's doing very well. He's disease-free and is going about his passions of teaching and being a father.
Zoo, and it's by Robert Lockshire. He is the author.
I went for my yearly physical, and they had found a spot, a lump. The doctor called, a couple days after I had the biopsy done and said, and I'll never forget these words as long as I live, unfortunately it is cancer. And I really couldn't even bring myself to say that word for the first few days. I had heard that Dr. Barbara Ward was the best. The minute I met her, I knew that she was the one to help me out. She had that compassion in her heart and really looked at me like I was an individual and not just a statistic.
Susan is a very special person, and I feel fortunate to have been able to help in her treatment. Her cancer was diagnosed by breast ultrasound, not by mammography. So fortunately, she was diagnosed sooner than some women who would not have had that ultrasound and possibly would have had to wait for a larger mass to appear before their breast cancer would have been diagnosed.
I felt lucky that the treatment went as well as it did. And I really think it was probably because of the care that I got.
There's no question that Susan had state-of-the-art treatment equivalent to any university setting.
When it comes to delivering the therapies, patients want to be in their own community. They don't want to have to travel down to Manhattan, in some cases for radiation therapy, for 6 weeks.
I personally think as a caregiver, my patients get better treatment at Greenwich Hospital than any other place that I've worked. And I feel strongly about that.
We offer help with some of the side effects of cancer treatment, particularly hair loss, not only on the scalp, of course, but the eyebrows.
They help you apply the makeup to make yourself feel better. You leave there feeling like, okay, I'm going to get through this, and it was just amazing.
Healing touch is a technique performed by trained volunteers at the hospital to help patients cope with the side effects of their chemotherapy.
Today I'm doing fantastic. I feel great. I feel very lucky. Lucky that I listened to my wife. Lucky that we caught it early. Lucky that I was with a great group of doctors.
The Cancer Institute at Greenwich Hospital is an enormous resource. I've worked in many major medical centers, university teaching hospitals, and now I work at Greenwich Hospital. What you get as a patient at Greenwich Hospital, and in particular the Cancer Institute, is state-of-the-art, nowhere better, and yet it's around the corner from where you live.
Having the cancer and going through the treatment has definitely changed the way I look at life. People tell me I look better than I ever did. I want to live long enough to see my girls married, and that was my goal.
I'm very optimistic about cancer care in general, but particularly in Greenwich, where our community has supported our Cancer Institute and enabled us to provide the best possible care to our area residents.
You know, you take things for granted, and unfortunately it takes these kind of events to make you realize what's important.
I was very fortunate to be where I was, to be diagnosed by doctors at Greenwich Hospital, having the surgery at Greenwich Hospital, and receiving the care that I did. On a scale of 1 to 10, they were an 11. And I look back at it as a very fortunate experience in my life.
Given the outstanding array of cancer resources that are available within 1 hour's drive from Greenwich, community support is highly critical in order to maintain our high-quality program and fulfill our commitment to the patients and their families.